All right, everyone, let's talk about some common pitfalls for leases. Now, many of you are having a hard time finding practices to buy. And so what are you doing now? You're looking at this and saying, okay, I'm going to open up my own. And believe it or not, it's actually less risky to open up your own practice from scratch than it is to buy someone's practice. I know it sounds counterintuitive, but it's actually less risky. Now, there are a lot of pitfalls with leases, so you have to be careful. One is make sure you're hiring a healthcare commercial broker to help you negotiate the lease, at least the business terms. There's a lot of money at stake. You can get free rent, you can get tenant improvement dollars, you can get a lot of things that you wouldn't normally get if you tried to do it yourself, or you may not get as much as you should be getting. So just kind of keep that in mind. The second thing when it comes to leases is making sure that what you're paying for, you're actually getting, right? So in other words, what is the square footage of the space? Is it rentable or is it usable square footage? That is really, really important, because sometimes some buildings have 20, 30, 40% difference between these numbers. And you might be thinking, hey, I'm getting a 2,000 square foot space, but you're really getting 1,600 foot space, which can definitely impact how many chairs you put in there, and or what you do as far as your office is concerned. So again, be very, very careful about that. Now, leases, that's just a couple of very basic things that you have to watch out for. There's a ton of other issues with leases, and so it's really important to have some professionals help you throughout the process. But again, make sure you start with a commercial broker, and then you have an attorney review it for you. All right, if you have any questions, let us know. Thanks.